This video does not constitute as medical advice. This video is just going to go over some of the specific things I've seen when it comes to sleep disordered breathing. These are all personal viewpoints, personal accounts. If you feel like you have any concerns involving your sleep or your breathing, please talk to a doctor. Sleep issues are extremely difficult to diagnose without having a sleep study, and the best way to know if you need a sleep study is to talk to your doctor. What is sleep disordered breathing? Sleep disordered breathing, which we can also abbreviate as SDB, is a catch-all term for things like obstructive hypopneas, obstructive apneas, or central apneas, or central hypopneas. As you can kind of see, we can divide sleep disordered breathing into a couple of different categories. We can look at it as obstructive or as central. Central events, central hypopneas, central apneas, those involve a pause in your breathing. And this pause is due to your brain not sending signals to your breathing muscles. So in this situation, your body's not even trying to breathe. It could look a little bit like holding your breath or failing to initiate a breath. And as you can imagine, if this happens while you're asleep, that's not good. That can lead to a lot of issues. Obstructive apneas, on the other hand, they involve a pause in breathing, not for lack of effort. Your body is still trying to breathe. It's still trying to cause that air to move. There's just a blockage of some type, normally in the upper airway. Now, because your body's still trying to breathe, this can lead to a lot of pressure building up because those muscles are working very hard to clear that blockage. We'll talk a little bit more about what happens because of that pressure later. For this video, we're going to talk exclusively about obstructive events. Central events are just very complicated. They can be difficult to deal with. So if you think that you have any central aspect going on while you're asleep, you need to talk to your doctor. Don't trust YouTube for any medical advice, especially if your brain is forgetting to have you breathe. So when we look at obstructive events, let's look at hypopneas first. Obstructive hypopneas can be thought of as baby apneas. And this is because an obstructive hypopnea is a small reduction in your airflow, while an apnea is an entire stoppage of your airflow. To get technical, an apnea is a 90% or more reduction in your breathing that lasts for at least 10 seconds or more, while a hypopnea is a 30% reduction in your breathing that lasts for at least 10 seconds. So the reduction is smaller for a hypopnea than it is for an apnea, but in most cases, clinically, for us to count it as a hypopnea, your oxygen is desaturating. You're not getting as much oxygen to the brain. You don't have as much oxygen in your blood when you're having a hypopnea. Now, what are the signs? How do you know if you have obstructive events going on? Well, some of the signs that might push you to go ask your doctor if you need a sleep study can include snoring, waking up with a headache, having a sore throat, having dreams of choking or drowning, and then having to urinate often during the night. Also, of course, being tired, feeling like you're sleeping a lot, but you're not actually resting, you're not ever recovering. That can also be a sign that there might be some breathing issues going on. So, how does sleep disordered breathing damage us? Well, if you think about those symptoms, those signs that we just talked about, you might be able to guess. So let's go back over them. Waking up with a headache, that can be a sign of hypoxia, a lack of oxygen getting to the brain. Chronic hypoxia can lead to brain damage. It can wreak havoc on your organs. And this is happening because you're not breathing as well. You're having an obstruction that can cause hypoxia, and that can lead to the morning headaches. Now, dreams of choking or drowning, that can be the real life sensation of that obstruction presenting itself in the dream. And then you might be like, well, what does having to use the bathroom in the middle of the night have to do with anything? Well, having to urinate often throughout the night can be a sign that there's some pressure building up in your torso. When you have that obstruction in your upper airway, your muscles are still trying to get you to breathe, and that can lead to a lot of pressure building up. And that pressure can be placed on your bladder, and that can lead you to having the sensation of having to use the bathroom. Along with that, that pressure is placed on your heart. So your heart is pounding because your muscles are really working to get that obstruction cleared. And then along with that, your heart is dealing with the added pressure buildup. This can damage your heart. And then, of course, if you're not breathing well, you're basically doing cardio every night, your oxygen's dropping, you're probably not sleeping well, you're waking up, you're tired. That can be a very obvious real-life negative effect that you can feel pretty quickly is that you're just tired all the time. You're sleep deprived. I have this video where I talk about sleep deprivation and how it can be an issue if you work out, if you exercise, if you have any intentions of competing in anything physical. Sleep deprivation can cause you to really be behind the curve. But in general, for everyone, if you have sleep disordered breathing, you're dealing with lower quality sleep, you're dealing with damage to the heart and to the brain, and that puts you at risk of tons of other illnesses that you really don't want to deal with if you don't have to. Now, how do we fix our sleep disordered breathing? Well, let's start with the bad news. Some people are just built that way. Their anatomy predisposes them to sleep disordered breathing. I've had people who run 5Ks or run marathons, and they're at a very healthy BMI, a very low resting heart rate, and in general, they look like they should be very healthy, but when they go to sleep, they have tons of obstructive events, and their oxygen is desatting throughout the night. For people like this, medical intervention is probably their best bet. Now, whether that is CPAP or one of the newer and honestly less tested devices like the Inspired device, they're probably going to need some help. Another option for the people who are just anatomically predisposed to STB could be a dental device. There are dental devices that use rubber bands or use a key that pulls the mouth forward, and for some people that can help them breathe a little bit better. However, from what I've seen, for the majority of people, there are two pieces of low-hanging fruit that we can probably tackle first. So first, people can try to sleep on their side. When people sleep on their back, also known as the supine position, you're more likely to have obstructive events. And this is because we're laying on our back and gravity's pulling our soft tissues down and causing a blockage. And this becomes even more of an issue when people are supine and they go into REM sleep. Why is that? Well, that's because in REM, our body naturally loses its muscle tension. We experience atonia, our muscles are paralyzed, which is probably to keep us from acting out our dreams. When this happens, this amplifies our susceptibility to OSA, to sleep disordered breathing. If you have sleep disordered breathing, if you have obstructive or hypopnea events, then they're likely going to be much worse in REM, and they will be much, much worse in REM while you're supine. So an easy fix might alleviate some of the symptoms, some of the breathing events, could possibly get rid of it entirely, is to roll to our side. Multiple medical devices can help us learn to sleep on our side. There's the tennis ball t-shirt. Then there's something like the Zuma. I might be saying it wrong. I've only seen it a couple times. But they help keep us from sleeping on our back. And then techniques that can be used at home for free would be to sleep with a stack of pillows behind you, or to sew your own tennis ball t-shirt. Another thing that kind of replicates it is sleeping upright. If you have an older family member who likes to sleep in their recliner, this might be the reason why. They're breathing much better on the recliner because they're upright. Now, there are ways to replicate this as well. Some doctors can prescribe a wedge, which is just a triangle that lets you sleep elevated. Obviously, there's the sleep number beds, and then you can, of course, stack a bunch of pillows to keep yourself upright. It's very important that you're careful with these solutions. Again, go talk to a doctor to make sure that these are useful solutions for you. If you need to use CPAP, if that's what the doctor thinks is best, don't work around it, work with it. But there are reasons to prescribe the wedge or the tennis ball t-shirt, or to have patients sleep on their left or right side. Talk to the doctor, see what works best. And to touch on this concept of sleeping position, this video is just talking about obstructive events. I've seen arguments made for sleeping on your sides, for sleeping on your back. I don't have a strong opinion either way. I believe if you have obstructive events, sleeping on your back might cause more harm than good. If you don't have obstructive events, if you are like me and you have weird jaw issues, then sleeping on your side might be an issue because it pushes your jaw in a bad position. Sleeping on your back might be better. But if I was dealing with sleep apnea, I'd have to weigh the pros and cons and figure out what I wanted to deal with. In most cases, my opinion is that it's just best to roll around and sleep however you feel comfortable. But for this very specific case, when it comes to breathing, humans do tend to breathe a little worse when they are sleeping supine. Now, the other piece of low-hanging fruit is weight loss. Obesity has a very large effect on sleep disordered breathing, specifically obstructive events like sleep apnea and obstructive hypopneas. I've had patients who have had severe sleep apnea in the past. They've had sleep studies. They've had very high AHIs, which is just the number of obstructive events that you have in a night, their number's very, very high. They qualify for CPAP, they sleep with CPAP for years, and then they do their best to lose weight. If you have a CPAP machine, in general, we want you to come back every 5 years to have another sleep study to see if you need more pressure, less pressure, or if you don't need the CPAP machine at all. Now, I've run studies on patients who have lost quite a bit of weight. They come in, have a much lower AHI than they did when they first had their sleep study years ago. For some people, this means they're done. They don't need CPAP anymore. For others, this means that they need less pressure. So, weight loss for some people can make a large difference on how well you breathe while you sleep. It's not a magic pill. It's important to remember what was said earlier. Some people are extremely fit, they have a really solid BMI, and these people might still have severe sleep disordered breathing. Sometimes some factors are just outside of our control, and medical intervention is the only option. Talking with a primary care physician and having a sleep study as needed is the only way to really verify whether you have SDB, or if it's improving, or if it's getting worse. If you and your doctor believe you may have sleep apnea, you talk with them and see if they can schedule a sleep study. Now, after the sleep study is done, once your doctor analyzes the results, ask what your AHI is. That's just good information to know. After the study is done, once the doctor analyzes the results, be involved. Talk to them and ask if they believe that weight loss would benefit you. Do they believe that CPAP would benefit you? Or maybe all you need to do is sleep on your side. Or maybe you need all three. Ask if CPAP can be a placeholder until you lose weight. Or does it look like CPAP might be the long-term plan? But either way, talk to your doctor, be involved, and really think about your options. Breathing issues affect a large portion of our population. Even if you feel like none of this applies to you, well, thank you for making it this far into a video that doesn't apply to you. I do appreciate it. But maybe consider sending this video to a family member who you think might need a sleep study. A family member who snores a lot, or who you hear while they're asleep, they're not breathing. They go seconds, maybe a minute without breathing. Maybe send it their way, or don't. Maybe just tell them what you've learned. But more than likely, we all know someone with sleep disordered breathing. Try to reach out and see what you can do to help them sleep better. But thank you for watching. That's the end of this video.